look at large trials, whether it's 200 people or 400 people, or even smaller trials like ours, which were sort of 13 and 24, you are wanting people to feel like they're not alone, right? You're wanting them to say, look, other people are anxious too, and here's an intervention that can work. But if you just take all of those large trial data and then dump it onto a system, you're communicating to people that they are not unique. And every person is different, and personalization does matter. And I think one of the biggest reasons that people are spending unnecessary money on mental health interventions is that they're not personalizing what they're delivering. Also, when you are working in a lab, a lab is a very particular set of circumstances, and it's actually a kind of false environment. And you can't really imagine that anything that works in a lab is necessarily going to work in reality. In fact, more than 50% of studies in the scientific literature, especially as they pertain to psychology, are not replicated. And what this tells us is that, there are lots of issues, things around sample sizes, about study design, but it also tells us that what's going on in a lab is not necessarily going to translate into reality. And I think anyone who's in charge of providing these mental health solutions really needs to set up a system where they can track what's going on in their own reality. From that perspective, I think that data collection and personalization is critical. And if there is no system set up for data collection, then I think that this really is related to stigma. If there's no budget set up for data collection, then this is really related to stigma. And we get to a more philosophical point here where I think when organizations are thinking about budget, part of what they want to think about is, do I want to be successful at a business level? And because businesses are made up of people and people have brains, if their brains are not working the ways in which you'd want them to work, it's going to impact them and it's going to impact the business bottom line. And in fact, studies at McKinsey have shown that when it comes to thinking about business success, organizational health is not just about strategy, it's not just about execution, it's also about paying attention to things like mindset.